Coronavirus disease is a respiratory illness that can spread from person to person and, and causes an infection on your nose, sinus, and upper throat. The novel coronavirus started in Wuhan, China, and officials named this new virus Severe Acute Respiratory Syndrome Coronavirus 2, SARS-CoV-2. How does coronavirus spread?
Okay, good.
The time it spread between people to people with close contact. That's why we need to keep 6 feet apart. Through respiratory droplets produced when an infected person coughs or sneezes. A person can be also infected by touching a surface or an object that has the virus on it, and then touching the mouth, face, and nose. And this is also another way they can spread. What are the symptoms? Some people may not have any symptoms, as we already know, and this is the biggest problem, and they are able to spread the virus. So fever, cough, and shortness of breath, the symptoms can appear from 2 to 14 days after exposure. But now let me ask you that. Who has a thermometer at home? Okay, most of you, good job. So whoever doesn't know, try to look in your drawers to see if you have one, because I think it's people are having a hard time to find them. And there are a few things that if you have a fever, you can do without a thermometer to try to be aware that you have a fever. So use the back of your hand, not your palm, and measure your forehead. Look at your cheeks. Usually they get a little bit, can get another hint about whether you are running a fever by looking at it. Like sometimes you get a little blushed over here. So just make sure. And take a peek at your pee-pee, your urine, because fever causes dehydration. So your urine can be a little bit more yellow. And ask yourself, or around people that love you, or who lives with you, like, can you touch me? And, you know, do I have a fever? But I recommend checking if you have a thermometer and if it's working. Sometimes it's not working because it's been there for so long without being used, okay? If you have, it is crucial to look for a doctor if you have trouble breathing, persistent pain in the chest, new confusion or inability to arouse, or blush lips or face. And this is not all the symptoms. So if you feel something different, you feel, I feel funny today, don't hesitate to call your doctor. So these are the serious complications. Pneumonia in both lungs, multi-organ failure, and death as we know it. Protecting yourself and your family. Avoid close contact with people, respecting social distancing, as we know, 6 feet. Avoid touching your face, eyes, nose, and mouth. Wash your hands often with soap water, 20 seconds. They were showing, I don't know if you guys can see me, but I don't think so, but wash it for 20.
I can.
They're seeing me? Okay. 20 seconds all over, between your fingers, under your nails, all over, okay? Take care of yourself, drink lots of water, avoid public transportation, and wear a mask in public to avoid contaminating others. Stay home, save lives. And this mask, I just want to let you know, it does not protect you from getting COVID. It protects others from getting COVID. The only mask that protects you is the N95. Protecting my community. Cover your cough or sneeze with a tissue and throw it in the trash. Clean and disinfect frequently touched objects and surfaces. Stay home when you're sick. Don't go out. And if you have other ones at home too, and you know that you're sick, just try to stay in the in your room and to not expose others. So is there a vaccine? Under World Health Organization coordination, a group of experts with diverse backgrounds is working towards the development of the vaccine against COVID. So this declaration, I'm not going to read it all to you, but it was touching when I was doing a research to share with you, like how hard they're working and asking us to stay at home and do our part in protecting ourselves and not spreading. So it was interesting to me what this declaration was. So how can I treat? Thus far, there's no specific antiviral treatment for COVID. Most people infected with COVID will experience mild respiratory and flu-like symptoms and can recover at home. Those with underlying conditions may need more supportive care. What is supportive treatment? What is that underlying condition? So, care given to improve the quality of life of patients who have serious or life-threatening disease. The goal of supportive care is to prevent or treat as early as possible the symptoms of the disease, side effects caused by the treatment of a disease, and psychological, social, and spiritual problems related to a disease or its treatment. Cross-contamination. Cross-contamination is the process by which bacteria or other microorganisms are unintentionally transferred from one substance or object to another with harmful effects. So when we put gloves, we think we're breathing, but now I have a quick video to show you guys how you can contaminate yourself even wearing gloves.
Okay, so I wanted to get on here and do a quick little thing here. I'm seeing a lot of people out in public wearing gloves right now. That's great. If you want to wear gloves, you know, that's all fine and well. You absolutely can. But I want to remind you of a little thing called cross-contamination. So let's say I'm in my car, I'm at Meijer, I'm getting ready to go into the store, so I put my gloves on, all right? And then I grab my cell phone. For this purpose, this little piece of cardboard here is gonna be my cell phone. So now I go into Meijer, walking around, I got my phone, maybe it's in my pocket, or maybe it's on the cart, okay? And I've grabbed my wipes and I've cleaned off my cart and I've cleaned everything off, but you know, I still have my gloves on. So here now I'm in Meijer and I'm getting my groceries and I reach for something and you know, let's just say I reached for toilet paper, right? Well, if you can find any, get some toilet paper. Well, I take my toilet paper and I put it in my cart, and now if you can see, I have all these germs on my hands from my toilet paper, but it's in my cart, but it's on my gloves. That's fine, right? It's on my gloves. Well, you know, but now I'm walking along and my phone rings. So I've now touched my hands together a couple times and I reach for my phone and I have a text message from my husband telling me to get more chicken. We need chicken tonight for dinner. So let me text him back. Okay, honey, I got it. I'll get us some chicken. Okay, so I put my phone back in my cart and I continue reaching for things, continue getting groceries, and you know, I just keep touching everything. Oh, my nose itches. Here, let me itch my nose. Okay, oh, now my phone's ringing. It's my mom. She needs me to get her something. Hi, hello, hi, Mom. What can I do for you? Oh, hi. Oh, my goodness, look at all this bacteria. Oh, but now here, it's okay. It's totally fine because I'm wearing my gloves. I have my gloves on. I'm so safe in my gloves, right? And you know, I'm done. I've paid. I'm at the grocery store. I'm all done. I've paid. My phone's back in my pocket. I get to my car. I reach for my car door handle, and then I'm all done with these gloves, and I don't want these dirty gloves in my car, right? So what should I do with my gloves? Oh, let's see. You take them off appropriately, and they belong in the trash. In the trash can, people. Instead of putting them in the parking lot next to your vehicle, please put them in the trash. So now your gloves are off, your hands are clean, you're in your car, you're safe, right? But oh, your phone rings again. Oh no, let me pick up my phone. Here. Oh, hello. Look, this is called cross-contamination. There's no point in wearing gloves if you're not going to wash your hands every time you touch something. There's no point, friends. So, do whatever makes you feel safe, but remember, there is some science here, and all this fear is just manifesting people into being crazy and not acting very smart. So one, go ahead, wear your gloves, but you need to clean your hands all the time. Don't touch your face. Don't touch your dirty phone. Look at this dirty, disgusting phone that got all over my face. Secondly, throw your gloves in the trash. They do not belong in the parking lot on the ground. All right, I'm done. I'm done with my craziness. Bye.
Yeah, and please watch it because it's very fun the way she showed how we can get contaminated by answering the phone at the grocery store and answering a text message and then going back to the grocery. So she shows with paint in her fingers how she can go all over, and then she itches. It's kind of fun. She's cute. So these are things, the myths that people are saying out there, that exposing yourself to the sun or to temperature higher than 25 degrees Celsius does not prevent the coronavirus. 5G mobile networks do not spread coronavirus. You can recover from the COVID. Catching the new COVID does not mean you have it for life. Being able to hold your breath for 10 seconds. Someone even told me that, and I got that information on the CDC site, or more without coughing or feeling discomfort does not mean you are free from the coronavirus or any other lung disease. Drinking alcohol, now I'm going to say Lysol, does not protect you against COVID-19 and can be very, very dangerous. COVID virus can be transmitted in areas with hot and humid climates. So what we do now, just keep positive. That which does not kill us, make us stronger. This too shall pass. Just do the best. Let's do the best we can. And reading that declaration from the researchers was very, again, I'm repeating myself, was touching to me because they're asking us to work with them to find a vaccine for that as soon as possible.